In the Iowa State House here with Senator Jack Hatch, and wanted to talk a little bit about healthcare reform. Senator Hatch, tell us a little bit, why does Iowa need healthcare reform?
Well, Stephan, there's no better example than what happened just today when Wellmark increased the premiums 18% to over 80,000 Iowans for healthcare. And these are 80,000 individual policies. These are the people who have health insurance that will someday be unable to afford it. These are people who can't get it through their employer, so they buy it themselves. On top of that, there are over 308,000 Iowans who are uninsured. So why do we need health care reform? Because Iowans are suffering. And it's expensive. Right now, when you don't have health insurance, if you don't have health insurance, you go to the emergency room. That's the most expensive form of health care. And you don't ever go back, because they won't take you unless it's an emergency. So you have a waste of time. You have no perpetual service. You have no preventive care. Senator Harkin has been a leader nationally of preventive care. And so what we've done in Iowa is we've created the Iowa Care Program, which provides an insurance policy, kind of like a public option, to those adults below 200% of poverty who are not eligible for Medicaid. Because not everybody's eligible for Medicaid. If you're a single adult, even if you're a married adult with no children and poor, you're not eligible. So we have a program that allows adults to be covered. We have a proposal this year that will allow any person who's sick to go to their local hospital to get care immediately when it's an emergency. Then they will be assigned a primary care doctor at a community health center, and we have 14 community health centers around the state. So we start treating people when they're sick and keeping them healthy. That's why we need it. And we need national health care reform because the states can't do it alone. It's just way too much money, and we are doing nothing really immediate to control costs. Why is Wellmark increasing those premiums? Well, they're blaming it on health medical costs. Doctors' costs, emergency costs, hospital costs, pharmaceutical drugs. But when you have an increase that high, it only means one thing. This system is broken, and if we can't have a system in this country that will allow every American to have health care, then we're a system that's not really that free. Freedom of choice means you don't choose not to have health care. Freedom means that it is covered as a right of citizenship, and that's the most important thing. And we want to be able to go and say to our constituents, you have health care, you have the highest quality health care, you have the best health care, but you have a responsibility as well, and we want to drive that point home, that there are individual responsibilities of staying healthy, eating right, and making sure, more than anything else, that our children are protected. And I'm proud to say that in Iowa, we passed last year a mandate that every parent has to make sure that their child signs up for Hawkeye, Medicaid, or private insurance if they're below 19 years old. So Iowa's doing great things for children. Now we need to do more for their parents.
Can you tell the viewers and readers of Insider Iowa, where is this year? Where is the process? There is a bill.
Well, right now, nationally.
Well, let's start nationally.
Okay.
We more or less know that it's been a disaster, that it's been shrinking and changing, that there is a lot of anxiety, that nothing much will come out of Washington.
Well, that's not true.
And so tell us if that's true or not.
I'm here to tell you and your audience that in a conference call that I had with about 60 other state legislators across the country, with the White House, with Nancy Andrew-Prahl, who is the healthcare czar for the president, that she has confirmed that the president is going to go after a robust, comprehensive healthcare system, that there's a lot of anxiety, that he has to take the leadership, that his summit that he's having with Republicans and Democrats in the House and Senate next week at the Blair House will be to bring out ideas that the Republicans say they haven't been included in. But he's going to be making a decision to get a bill through Congress. And like Iowa, it may be incremental, but we have to control the costs. Once you control the costs and you increase the access to everybody, then every American will be able to have the quality health care that we deserve. Now, That's not going to happen overnight. But it is going to be a comprehensive, robust reform that the president is going to have, and I predict, and I know you'll keep
And
me on
that's
that.
pretty,
I'm going to
you're going
predict
to be on video, yes.
we will have national health care reform within 30 days. And in Iowa, what we've done is that this is the third year of major reform on health care. First, we expanded Medicaid to more people, and we created a variety of healthcare councils that would allow more children into the system, have electronic health records, identify a medical home, so where you have comprehensive coordination of care, and that we would have palliative care in certain areas. Then we went and ensured that every child, because we talked about that parental mandate, every child would be covered by, most children would be covered by health insurance by the end of this year, 2010. And now, in this legislature, we have a bill, Senate File 2356, that will expand Iowa Care to more access points. This is for adults under 200% of poverty, and have them put in primary care. And that's in the Senate. It's ready for debate next week. It had bipartisan support out of the Senate committee. One Republican voted for it, and we hope to get more. And we think that when people realize really how unaffordable health care is, and how every child is affected, every family is affected. We know people who have been denied coverage or can't get coverage or can't get an operation or can't get a disease under control because they don't have the money or the insurance for it. We know it's a problem. And so Iowa is a state that's really going forward pretty fast.
And tell Insider Iowa viewers and readers why this will also be a cost-saving move for the state of Iowa, because there's so much discussion about tax and spend and how expensive these things are. How does this kind of reform actually become a savings for the state?
Simply put, the system we have today in America treats you when you're sick. And when you treat somebody who's sick is very expensive. This whole flip-flop now, or this change, we're going to start treating people to keep them healthy. So you have preventive care. You have them going to see the doctor more often. The chronic diseases don't become that more chronic. They become controlled. Mm-hmm. And so you will not be spending all these times and all these tests. You will no longer have uncoordinated care. So you go to one doctor, you have exams and tests and x-rays, you go to another doctor, the same thing happens. Those are expenses that we have to stop the duplication. And then if everyone is covered, you really have a bigger pool so that everyone shares the cost. And the one thing we do have to do that we're not doing a good job at, but we have to do a better job. And the president's representative, Nancy Enterpral, said this yesterday, that his first objective in this bipartisan summit is to control cost. And we've got to control the outrageous costs that our medical system is included in, including some of the outrageous insurance practices of kicking people off because of pre-existing. What insurance companies do is that if you get sick, you have a heart attack, and you get better, and then they may kick you off and make that a pre-existing condition. They'll cover everything except another heart attack. And that's the kind of practice we are going to stop. Mm-hmm. And once you stop those practices and you start people treating for themselves, that cost will come down. So we know that we can't just give money. It's not a bottomless pit. No. I came right today from my first budget hearing. I'm $400 million that I've got to cut from last year. And I'm the chair of the House, of the Senate. I'm co-chair of the House-Senate Joint Committee on Health and Human Services. I am the co-chair of the committee that funds health care. And they're telling me I've got to cut my budget $400 million. This is a real problem. We can't cut our budgets and leave people vulnerable unless we really understand what the consequences are.
Jack Hatch, thank you so much.
Very much.
Great talking to you. Stefan Schmidt for InsiderIowa.com.